Thank you, Dr. Paul, for being here. If you'd like to introduce your team.
Sure. Good afternoon, Madam Vice Chair. With me are, on my right, Peter Fontaine, Bureau Director for Administration and Finance. On my left, Diane Harden, our Finance Manager. We have several of our senior leaders in the gallery. I won't introduce them because I can't see that far.
Thank you so much. As stewards of taxpayer dollars, members of the council have been charged with ensuring public funds are used in an effective and in an efficient manner to deliver the maximum service to the citizens of Nashville. If the budget includes an increase, could you please present to the council how your additional funds would improve these services? And if there's no additional increase in funding, how will your department sustain the level of services that you're now providing? The floor is all yours.
Thank you very much. We have a total of 5 budget improvements that are in the proposed budget. 3 of those budget improvements represent budgeting revenue that is already projected and coming into the government, and so those are essentially paid for. And then 2 that are discretionary. I'll start with the 3 that are paid for. First is food protection. This is an addition of 3 FTEs. We inspect food establishments under a contract with the state of Tennessee. Nashville's getting bigger. There are more fees coming in and more work to do. And so what we have is an enhancement in revenue as well as a need for 3 staff to cover the inspections that are required. The second one is vital records. This is a situation where the state increased the fee. We pay fees for birth and death certificates to the state health department. A portion of those fees remain here in Metro. The state increased the fees, and we are charging those fees, and they're coming into the general fund. What we're asking is that those fees be appropriated so that we can go ahead and pay the state. There's also some room for 1 FTE within that improvement. The third one that's covered by revenue is private stock vaccine. Now, in the department, we believe in immunizations, and we believe that anybody who walks in who needs an immunization should be able to get one. If somebody comes in, they've got insurance, they've got a means to pay, we can't use federally purchased vaccine for them. So now we need to essentially charge them or charge their insurance for that vaccine, and that's a separate vaccine supply. And so we've been doing this and collecting $80,000 of revenue that goes to the general fund. What we're asking for is an improvement so that we can purchase vaccine and sustain the program. So those 3 are really asking to appropriate funds that are coming in to sustain those 3 programs. There are 2 improvements that represent discretionary local funds, and they're both in the mayor's priority area of children and youth. The first is a coordinator to facilitate development and implementation of community action plans related to adverse childhood experiences. There's been a lot of conversation in Nashville across many sectors, nonprofit, government, criminal justice, education, about the impact of healthy brain development and the impact of adverse childhood experiences and toxic stress on brain development. And there's lots of motivation, both in Nashville and in the governor's office and statewide, to basically change our practices so that we're more responsive to preventing adverse child experiences and mitigating them. So that is a position that's new, and we've focused on that activity. Second is a part-time audiologist. Our new building is equipped with a hearing booth to do hearing testing, and yet at this point we don't have a audiologist funded. It's a long story. There was a state program which basically changed its design, and we no longer have it funded. But as we're out there serving children in Nashville, we're finding many children who need hearing testing but are waiting 2 and 3 months in terms of a waiting list to have the service done. So we would like to be able to offer the service in our facility to reduce that wait time for the children that we're serving. Those are the 5 improvements that we're asking for. We thank you for your support.
I see no one in the queue, and I will ask a question, if that's okay. It obviously has to do with your audiology position, because I know just a little bit about that.
Okay.
Is this a program that you could facilitate through group screenings such that you could partner with either TSU or Vanderbilt, and there's students that are needing clock hours. Would you be able to facilitate some sort of a clinic periodically that could help in the meantime and reduce that wait time, at least to do screenings?
So other than hiring somebody ourselves to do it, to work with a partner organization to serve that purpose, is that what you're asking?
Yes.
It's not something that we've spent a lot of time thinking about. It is potentially possible that we could look into that.
Thank you very much. Well, now we have some members in the queue. So, Councilmember Cooper.
Thank you, Doctor. Just while you're here, of your 525 positions, how many are nurses in schools?
How many school nurses do we have? Give me like
Okay.
10 seconds. I should know that off the top of my head.
I have all three of your microphones on, so whoever
71.
wants.
70, approximately 71.
Approximately 70.
Of that, okay. Thank you. That's very helpful going forward. So about more than half the schools, or about half the schools are uncovered then with nurses.
Right. I mean, our focus with school nursing is children who need a nursing procedure during the day. And so nurse will go to the schools where those children are and often go from school to school. So they're not really staying at one school during the entire day. But if you look at all the kids needing procedures and where the nurses have to go, there's about 30,000 children whose school never typically sees a nurse.
So would you have an estimate of what that would cost to cover those 30,000?
Yes, we do. We presented a public investment plan on a potential for a phased increase in the number of nurses. And so that's available. I don't have it off the top of my head, but we have worked on that. And we've also, it ends up being kind of an expensive program. But we've worked on even a version of it that would be a nurse assigned to 2 schools, plus 1 for every high school. So I think the response to our public investment plan was favorable, but we want to look at every option to make sure that we're making a good recommendation going forward.
Okay. But you could make that available to us later. Thank
Sure.
you, Doctor.
Mm-hmm.
Thank you, Councilmember. Councilmember Schulman.
Thank you, Madam Chair, Dr. Paul. A couple of questions about the audiology position. So it's a children's audiology position.
Mm-hmm.
Older Nashvillians, would you serve them if you had a person who could actually help them in that situation? Or is this just specifically designed for children?
I'm probably not an expert, and I think if there is a person who can do both children and adults, we actually do some hearing screening in our function as occupational health provider for Metro. And so there is some overlap there, at least of the use of the booth, if not one person that could serve both.
Well, I guess, and the chair may know better than anybody, but obviously this is designated for children, and since we try not to forget that we have an aging population, if people come to the health department and need a hearing screening because they're at risk of obviously losing their hearing, where would you send them if you couldn't do it within the health department?
I think we would go through our whatever channels we have with the healthcare safety net. So it would be through the safety net health care providers.
Okay. Let me just follow up. Do you all keep records of how many people have actually children have come in and haven't been able to be screened because of the lack of a position or half a position?
I wish I had that for you. I don't. I have mostly anecdotes about the wait time at the major provider in town.
Okay. The only other question would be, if you went from a half-time position to a full-time position, obviously you'd be able to serve more people. Do you think you might actually need a full-time position for this?
I think we wanted to start with half-time because we're not 100% sure of demand. One of the things that we want to do is, obviously many of these children who are facing wait times have TennCare and would have a source of payment. So I think what we want to do is get started and assess what the need is out there, and then grow it grow if it seems like there's a demand.
And Madam Chair, I just, I'm not sure, in terms of obviously there's a halftime position here. I hate the fact sometimes that we, particularly with older residents, that they might need that same type of service. So again, I might actually add something to the wish list in terms of maybe a halftime position, actually look at maybe serving older folks that need the help as well. And again, I'm not sure if that's something that you could use, but I assume the equipment, and I'm not an expert in this either, but the equipment that you have hopefully could serve all age populations.
May I answer that for you?
You certainly may.
Thank you.
For the viewing public, I am an audiologist, so I know a little bit about this. The equipment is totally capable of doing testing from babies all the way up to geriatrics. In particular, I'm fully aware of this position because the previous audiologist is a friend, and it is a part-time position for the capacity that they currently have. However, there are other testing protocols geared to children, auditory processing disorders that affect language, that affect the ability to successfully complete reading comprehension assignments in school, that lead to behavioral issues. So there's a myriad of audiology procedures that we can gear towards children that this equipment is totally capable of performing. And so to your point of a fuller time audiologist, if the responsiveness of that audiologist to the needs of that population were greater, yeah, absolutely, it can facilitate more hours for that job. As to the geriatric population, you have a myriad of providers in the community that do take Medicare and Medicaid. The wait list for those providers is quite long. And so to be able to offer something within the health department, and this is something that we've discussed in the past, to offer something to the health department that would facilitate geriatric care would be great. To also look at a safety net, if you will, program to provide hearing aids to those people out there that need them, that absolutely fall within that population. There are programs out there that we could partner with to make that happen.
I just think it's a good idea, and obviously I thought you would probably know the answer, so I appreciate it. And Dr. Paul, this isn't, it's just, it may be recommending some additional time for somebody to actually go in there and actually utilize this good equipment that you have. So, thank you.
Thank you, Council Member. Are there anybody else in the queue that wishes to be recognized? Seeing none, thank you, Dr. Paul.
Thank you, Madam Chair. If I may, I said I wasn't going to, but I'm going to introduce a few of my senior staff. Muriel Hodgson Vargas is our new Bureau Director in Community Health Services. Tina Lester in Population Health. Dr. Sami Ariola in Environmental Health. And Peter's here. And anybody else back there? Jim Diamond, Assistant in Administration and Finance. All right, so thank you.